Hello and welcome to this CureMD offered educational webinar. Our topic is protecting your income as patient financial responsibilities rise, or in other words, damn the deductibles because those are rising. My name is Robert Goff and I will be presenting what I hope you will find to be information that will be useful for your practice, protecting your practice's income. Now, the information that I'm presenting is general information, and it does not substitute for legal advice. If you need legal advice, please seek the assistance of a competent attorney. And of course, no comments are made regarding health plans and your participation. Since 2008, general annual deductibles for covered workers have increased 8 times as fast as wages. This has meant two things. This has meant a tremendous financial impact on patients and their ability to pay for the costs of their care. But it's also meant that physicians are now seeking payment for their services from the patient. The patient has become the payer. As you can imagine, this economic pressure is negatively affecting patients' ability to pay and therefore also increasing your practice's ability to keep its bad debt and its receivables under control. Patient responsibilities are the new norm. And while they've been inching up over time, they really have dramatically increased as of late. Gone are the days of the $3, $5, and $10 copays that were ushered in by the HMO movement. It's no longer chump change. Back in those days, even if you didn't collect, it wasn't a big deal. There wasn't a big hit to your economics. The affordability of copays has really become an issue, and the deductibles have hit the patient and you very hard. The average out-of-pocket costs have topped over $1,800, and as you can see, the impact can be significant. I'll point out that 49% of the patients have less than a $500 impact. There's a reality that we have to look at, and that is the Federal Reserve did a study on Americans and found that 47% of Americans could not come up with $400 in the event of an unexpected emergency. So that while many people will say, gee, $500, that's not bad, I can handle that. Unfortunately, many Americans cannot readily handle it. 40% of the patients now are in what are known as high deductible health plans. That means that their deductible is $1,000 or more. Now, deductibles have really taken hold within the insurance offerings. They really grew tremendously with the advent of health reform, which created the structure that we're now familiar with of bronze, silver, and gold levels of coverage. And these health exchange products, which have those built in, have now also been adopted for the commercial plans, most commercial plans, that are outside of the exchanges as well. The most common level of benefit is that silver level, with a $2,000 deductible on an individual and family deductible of $4,000. However, deductibles can be anywhere. There are some plans, some self-insured plans, some plans that are built around catastrophic can run as much as a $10,000 deductible. There is no limit on how high of a deductible that an employer can put in. Now, this has implications for your practice because for many practices, especially those in the primary care areas, OBGYN, primary care, the services that are being provided may be such that 100% is being paid for by the patient. Now, this means that physicians have to make a certain decision, which may be good for their practice, but bad for the patient. That is, do you continue to participate in a health plan? If your patients are paying virtually 100% of your bills, you're going to have to ask yourself, why do you stay participating with the health plan? After all, the plan isn't giving you any revenue. You still have to bill them but the patient is paying the deductible. Because of the deductible, they're paying 100% to you. So many physicians are reconsidering whether or not they should participate. Before dropping out of a health plan, out of what would be a very legitimate frustration of no value to participation, remember, if you do drop out of a health plan, your patient is going to experience the problem because any services you do render are not going to be not only not covered if they have a catastrophic event, but even your referrals and even your prescriptions won't be honored by the patient's health plan. So I understand how difficult it is for an office to collect the money from the patient, still have to bill the insurance company, deal with all the insurance company rules, and then say, legitimately, why am I participating? But most physicians don't participate with insurance plans because of the money. They participate because of the benefit it brings the patient. However, given that the out-of-pocket obligations of the patient are hitting the specialties differently across the profession, you're going to see differences. Obviously, the bulk of the issue of deductibles hitting the primary care, the internal medicine subspecialties, OBGYN, and obviously less in the areas of the heavier specialists such as surgery. Now, knowing that the patient has a liability and collecting that liability are two different things. The patient arrives, one of the great questions is, how much do they really owe? All right. We now know that, as I mentioned before, the percent of dollars coming in from the patient are increasing. Overall, 30% of physician practice income is now in patient payments. And 44% of physicians are expecting to collect the deductibles from patients. The reality, of course, is, as the previous slide noted, many physicians it's going to be a much higher percentage. But as that's growing, what are you going to do to protect your income? How are you going to protect it? Now, the percent of outstanding balances collected at time of service, well, the bulk probably is affordable in the $35 range. But, as it gets higher, it becomes very difficult for the patients to pay. So then what become your options in terms of collecting? Because you're dependent on that patient revenue. Well, at time of service, and obviously that is the best, that's when the cost to you is lowest. That's actually the greatest chance of collecting. They're in front of you. They're there. But you need to know the patient portion of the bill reliably. And that's a real problem, to know what it is with accuracy. Many of the tools that the health insurance companies offer online, they're not guaranteed. And they may not be accurate, which means you may be collecting too much or too little from the patient, adding to your administrative burden to then adjust, either to bill and try to collect even a smaller balance, or having to refund. And of course, collecting at time and expecting it to be paid by check or by cash right at time of visit is an immediate burden on the patient, and likely unexpected. Now, after they leave the office is when the cost goes up and your chance of collecting goes down. However, it does have the opportunity of probably being far more reliable as to what's owed. Submit the bill, know what the balance is, and then bill the patient. In a perfect world, it would be easy if the patient just paid the bill at that time. However, we know that that's not the case. If you don't collect this money, you're going to see your income drop. If you turn over balances to collection, because you've given up, you're going to lose 30 to 50% in fees to the collection agency. So there are a couple of other thoughts that come up. Trying to take that time of service event and collect then, or at least structure it to assure payment. Obviously, cash would be best. Cash would be king. Now, can you get it? Do the patients have it? Very few people are carrying the amounts of cash necessary to pay the deductible. All right. Checks, obviously, practices should take them, but you're running a risk of a bad check. Now you can, if you're going to take checks, have the ability to have check guaranteeing services through your bank. There are fees associated with it. And then there's swiping the credit card. And then you have, of course, the credit card processing costs. Now, the problem that you run into with all of these things at time of service, again, is the accuracy of what the patient actually owes. 83% of offices report that they estimate the patient responsibility inaccurately. Again, that means they're over-collecting or they're under-collecting. Over-collecting a refund, under-collecting means you are now billing and all of those issues. There's another thought that comes up, and that is to use a credit card as a guarantee. So rather than having the patient pay at time of service, obtain from them an authorization to bill their credit card for the balances after the insurance's payment. Okay, this is probably the cleanest way of doing it. The patient authorizes their credit card to be billed. You have that information. You bill the insurance company. The insurance company comes back and confirms definitively what the copay is, what the deductible is. Bill the credit card. Let the patient know. The issues that come up are twofold. One is, is there a problem with the credit card in terms of it being valid? Well, you can easily test it the way most businesses are now testing credit cards to make sure they're valid. Or you could even do what the car rental companies have, and that is to put an estimated hold on the credit card. These claims are processed fast enough that this generally is resolved before the patient has the bill hit their credit card. There is an issue of patient resistance, and it requires education of the patient. But patient resistance to this concept is actually dropping, and many are finding it convenient, so that as long as they're estimated beforehand roughly what will be charged, and then told what has been charged so that they know. Now, after time of service, to increase the likelihood of payment, there are some techniques that you should look at. Look at your process. Obviously, you're going to try to collect the copay at time of service, but that unknown deductible or the deductible balance is still there. Make sure your invoice is easy to understand. I recently looked at an invoice that someone received, and it just gave a dollar amount. There was no description, there's no CPT code, there was no way to verify it. It was services, which required a phone call, which then the biller said, we'll send you out one with that information. Well, why do it? Make sure you have a clean, easy to understand, and complete invoice. Send it promptly. The sooner you can get it out, the sooner it's fresh in the mind of the patient of the services that were received. And then to try to have them pay, give them options. You can offer a discount for payment in full. Pay within 5 days, receive a small discount, but discounts do motivate. Offer a payment plan. Remember, that deductible may be $1,000. Very few patients have the ability to pay that all at one fell swoop. So offer a payment plan. That could easily be set up. And take credit cards and allow them to pay you by mail, online, even mobile applications. We have to move our outreach to the patient when it comes to collecting our bills to the same way every other business is moving. Right? Now, you want to eliminate as many reasons patients don't pay as possible. The issue of lacking financing, again, we want to give options. Credit cards, payment plans. I just received my statement. Well, again, promptness becomes an issue. Offices that wait a long time for this have more problems. Now, we've seen now that offices can submit their claims electronically. If you submit your claims electronically, then your payment is much promptly paid to you from the insurance company. So if you're going to send the bill out after you get the payment from the insurance company, make sure you are billing basically the same day. and there's no reason not to. Your turnaround time from the insurance company should be about 20-25 days, an invoice then going out to the patient. I forgot to pay, confused what owed. Well, again, clear invoice. If you have their electronic email address, use the email to remind them, give them the tools to pay right then online. We are seeing an interesting group of patients that are not paying their bill because of the belief that healthcare is a right. This is being known as protest debt. However, it's still owed. But if you had taken the credit card as a guarantor, then your ability to override this and other issues is very real. Now, I mentioned before this concept of using the credit card with an authorization to charge it as a protective tool. And there are some significant benefits that come to your practice by doing so. The issue of whether or not there's an ability to pay at time of service is resolved. You're going to build a credit card. Therefore, you're not asking the patient for any cash at time of service. Additionally, what we've learned and should know is that eligibility verification is not guaranteed by a health plan. So you are now able to authorize that credit card to pay the full service if there is no eligibility for coverage. This is the same thing when it comes to benefits. You may have gotten the benefit verified, but it's not guaranteed when your claim is actually submitted. You don't need to fight that battle. You can build a credit card and let the battle begin between the patient and their insurance regarding the benefits. Someone who has a health savings account, I'll pay for my health savings account. That money may never materialize. That account may not even be funded. And of course, copays, I collected a $10 copay because that's what it said on the card or on the website, but it was actually $20. And the deductibles, which are estimated, it's assured the accuracy of that deductible because you're now charging the credit card after you've received response from your bill to the insurance company. So on those credit card authorizations, because it is something a little different, it's very important to educate patients prior to the service that this is what the expectation is. Many offices do this by a letter to the patient as part of their welcome. They remind the patient with a reminder card that the office does not take cash, and taking cash in office can be problematic. Cash has a habit of disappearing, the record keeping. It's a lot easier. You remind the patient you're not taking cash, you're expecting a credit card at time of service, and most patients will comply, especially when they know beforehand. A very nice letter explaining why it's necessary is very appropriate to send out as part of the welcome or have as part of the registration material. Use this type of program, though, for commercial patients only. Medicare, Medicaid, it's not appropriate. Now, we have to realize that it's very ugly out there and getting uglier. But it's your money that's at risk. So you need to think through your plans to collect from patients. 42% of providers did not know what the patient responsibility was during time of visit. That means if you're estimating to collect, you have a likelihood of being wrong. 75% said it took more than 1 month to collect from a patient. An authorized credit card will avoid that as being an issue. 78% said they typically mailed more than one paper statement to a patient to collect. That's an awful lot of administrative costs. Trying to move that collection to time of service by payment at time of service or by a credit card eliminates that problem as well. 56% said collections from patients was a significant revenue cycle issue. Again, collecting at time of service, either actual payment or the credit card guarantee eliminates this. Scary number, 80% of self-pay accounts are never paid in full. Expecting the patient to be the payer shifts the financial responsibility to the physician. 50% of patient financial responsibilities become bad debt. That's a very scary number for practices that don't have a great margin out there. So as some summary thoughts and to understand, the patient is now your payer. The patient is the payer to the physician practice. They are going to be providing more and more of your income. Less and less of your income, in particular in the primary care specialties, is going to come from insurance payments. Your office services are largely going to be paid for by patients going forward as those deductibles increase. If that's the case, you need to look at your process for protecting your financial well-being by looking to move the collection process to the time of service, either by collecting or by guaranteeing that collection. And if you're going to be involved in collecting after the patient has left your office, make it easy. The days of just sending a statement without detailed information are over. You need to meet the patient as the patient deals with any business. Simply and easily. Electronic billing, the ability to pay over time, pay online, pay mobilely. Your processes need to match the new patient. So thank you for joining us. I hope you found this information of interest and hope you will join us for future webinars.